Canada's top doctors are calling for a prohibition on the prohibition of illicit drugs.
It's a medical issue. It's not a criminal justice issue.
There's been a growing body of evidence from countries around the world that this doesn't work.
The provincial health officers from either side of the country co-authored a report on the subject published in the journal Open Medicine, arguing that there is no scientific evidence to suggest drug use would increase if health-based models were emphasized over law enforcement.
It's essentially an unprecedented outpouring of support for a total about-face in the war on drugs.
They join a growing chorus that includes current and former Vancouver mayors, as well as billionaire Richard Branson, all arguing the war on drugs isn't working, specifically when it comes to cases involving marijuana.
That has failed in the United States. It's created an enormous expense of locking up nonviolent people.
Her husband, Mark Emery, among them, the longtime advocate for legalizing weed, is currently serving a 5-year sentence in a U.S. federal prison for selling cannabis seeds. The Conservatives just voted in favor of new minimum mandatory sentences for minor drug offenses, something the medical professionals insist won't solve the problem, and argue in favor of taxing and regulating drugs like pot. The Police Association disagrees with the approach.
I don't know of any product or service that the government's gotten involved in that then ends up being cheaper than you can produce in the black market.
And the Harper government dismisses it.
This government has taken substantial efforts to try to curb smoking. One of the things we won't do is try to legalize marijuana, Mr. Speaker.
Especially not now. The Prime Minister's tough-on-crime bill only just passed. The science cited here comes 2 weeks too late. Lisa?
Thank you, Sarah, from Vancouver tonight.